For many of my patients, gum disease is something that they don't even know they have, and it's hard for them to even understand why their teeth are moving, why their breath is bad. And so today I want to talk about what gum disease is and why it doesn't hurt until it's too late. Hey guys, it's Dr. Heath Lampee here with Teeth in 24. A lot of my patients, they haven't been in the dentist in a long time, and I get it. You guys are terrified of the dentist. You've had bad prior experiences, and you stay away. I understand. You probably want to stay away from the IRS too. I get it, guys. But gum disease is a silent infection. And what it is, we've got different types of bacteria strains in our mouth that are usually in balance. And we all have some of these different bacteria in our mouth. And usually they're cool, they don't over proliferate. They're not like the gremlins, if you feed them after midnight or get them wet, they're not all multiplying. But certain people have a genetic predisposition for these bacteria to start multiplying. And it's all right to have some of these bacteria in our mouth, but when they start multiplying, that's when our oral biome, our makeup of bacteria in our mouth totally changes, and we start really getting the gum disease. So gum disease starts with a little bit of something called gingivitis, a little bit of a redness or a pinkness in the gums, a little bleeding in the gums. That's easy to ignore. But over time, what happens as that gets worse, it's not treated if you don't come in for regular cleanings, or if genetically you have really, really bad gum disease. What happens is that these bacteria start creeping underneath the gums even more, and they live in an environment, a dark environment that doesn't even need oxygen. These bacteria, they're called anaerobes. Anaerobes are gnarly little buggers, and when they get underneath the gums, deep in there, they start burrowing, and they start destroying the bone that's holding the teeth in place and all the collagen also around the tooth as well. So you get this immense destruction of the bone, collagen, everything around the teeth. And what happens over time is that this is a very, very quiet process. And over time, we're talking 5, 10, 15, 20 years, you're going to start noticing your breath's getting a little worse. Your teeth might even start shifting a little bit. You might even get little like gum pus bubbles sometimes, but they go away. Nothing's too terrible. It's not waking you up at night. It's not like one of those toothaches you hear about that, sends someone to go get a root canal or an extraction, where it just turned on like a light switch. Your teeth start moving. The gums get even more inflamed, even more bleeding. And you finally start realizing something's not right here. I haven't been to the dentist in 5 or 20 years. I don't have any pain, but something's going on with my teeth. They're moving. They're starting to get space. They're shifting. My spouse keeps on saying that I got terrible breath. I don't want to go on dates anymore if I'm on the dating circuit. People are staying away from me. And they're starting to look really bad. And so finally you come in to see me, Dr. Lampee. Now, when you come in for a consult with me and you, we're going to sit down. We're going to take some photos, take some x-rays, and figure out what the heck's going on. And so for a lot of my patients, they come in and I get the x-rays, I get the photos, and I look at all the stuff at my desk before I meet you, by the way. And so I already have a good idea of what's going on. For a lot of my patients, the gum disease has progressed to the point where I cannot save the teeth. It is seriously that bad. And so if I look at those x-rays and see what's going on, that the gum disease has progressed beyond the point of repair, and this is the point where probably at least half or more of the bone and gum tissue that holds the teeth in place is gone. This is called severe periodontal disease, and it's a generalized chronic condition with these gram-negative anaerobic bacteria, these gnarly buggers, like I'm saying. So what we do with our patients with this is, if we cannot save the teeth, what we do is in one day with sedation, all my patients are sleeping, they have great experiences. We take the teeth out. We have to say goodbye to them. The only reason these gnarly bacteria are in your mouth, seriously guys, is that the teeth are there. When I physically remove the teeth, the bacteria are pretty much going to go away. They can only latch and multiply if there's a physical tooth in your mouth. That's their substrate. That's what they like to just grow on. So when I say goodbye, adios to the teeth, those bacteria are going to go away and your infection is cured. We do full mouth implants that day as well. That's teeth in 24. And one day you get sedated, we take the teeth out, I scoop out the infections, I rinse everything out with probably 3 or 4 different antibacterial rinses. I kill those bacteria. It is my job to kill bacteria in your mouth so you will be healthier. We put the implants in right then and there, and then you get permanent, beautiful, healthy smile that looks amazing and natural that very same day. Now, I've also got another tool that I use for my patients with gum disease as well. It's called the Periolase Lampee laser. It is an FDA-approved laser with a patented protocol that I got trained on almost 10 years ago. Now, this laser is pretty amazing. It's incredible. It took me over a year to get trained on this. It was a serious investment for my practice, and it's one of the best things I've ever offered my patients. Let's say you come in for a consult and you come in when we can still save your teeth. Maybe you've only lost 10, 20, 30, 40% of the bone holding your teeth in place. The bacterial infection, the chronic gum disease hasn't progressed to the point where we have to take the teeth out. What the laser can do with its different laser wavelengths is I can actually, well, first, I get you sedated again, and I'm going to do a full laser treatment underneath your gums. And the laser wavelength is going to pulse, and it almost, when it's pulsing, it almost sounds like popcorn popping, if you believe it. Pop, 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 pop. By using this laser's energy, it kills the bacteria that are underneath the gum line. And once the bacteria are killed, actually will ultrasonically clean the teeth underneath the gum line to remove any of those slimy, thick bacterial deposits, plaques, tartar, and just clean it up, get a good substrate. This Lampee procedure that we do can stop this bone loss, can arrest your gum disease and make these bacteria chill out so I can actually rebalance the population of bad versus good bacteria, because gum disease is always when the bad bacteria start winning. So Periolase laser is just going to bring them back into balance in your mouth between the good and the bad bacteria. Now, once we do the Periolase Lampee laser procedure, you do need to come in every 3 to 4 months and have a cleaning with my hygienist for perpetuity. We have to stay on this to make sure the bacteria do not get out of balance again. And so with that, there's always a chance that, say, 4 or 5 years after the Periolase laser, that there's a chance we might need to redo that procedure. And so it's something that we can do. So for my patients with periodontal disease, I know it doesn't hurt, but it is one of these gnarly infections that is totally hurting our body, our bloodstream. The mouth is kind of the gateway to the bloodstream. That's what we're finding. These bacteria and their byproducts that they're creating in your mouth actually get into the bloodstream. And what we're finding, this chronic inflammation, this chronic infection from periodontal disease is affecting risk for heart attack, for stroke. They're even doing research into Alzheimer's and cognitive dysfunction. With all this chronic inflammation and chronic infection, it can do detrimental damage to your health. So it's imperative to get it taken care of, guys. You know, in today's day and age, we want a healthy body. We understand what chronic inflammation does to our body, to our immune system, to our cardiovascular system, and we're starting to find out what it does to our brain. If you want to live longer, be healthy, and actually feel good, you've got to take care of your gum disease. And I know it's scary, guys, but you need to step up and say, okay, I'm an adult. We can take care of this. Dr. Lampee is one cool dentist. He's got some amazing skills. He's going to listen to me. Everything's going to be all right. I'm going to be healthier because I saw him. Whether we have to do full mouth implants with teeth in 24, or we can use the Periolase Lampee laser. A lot of my patients want to know, how do I know I have gum disease, or what are the symptoms of gum disease? If you have very inflamed gums, a lot of bleeding when you brush, when you floss, if it's painful to eat, if your teeth feel like they're moving, starting to shift, if you're packing food in between your teeth and it's hard to get out, that's one of the major symptoms that you know you have gum disease. And also, a lot of times, if you're diabetes isn't doing well, it means that you might have gum disease in your mouth because they're highly correlated. Unchecked gum disease can actually mess up your diabetes and cause you to have a higher A1C. And I find that once the gum disease is treated or terribly infected teeth are removed, diabetes management improves, A1C goes down, and the patient is much healthier afterward. What is gingivitis? Gingivitis is a mild inflammation of the gums. It might bleed just a little bit. And it is the start or precursor to gum disease. This is before the bacteria have really entered the gum pocket and started destroying the bone that holds the teeth in place. So gingivitis is just the very, very first sign that something is wrong. So that's why we do recommend 2 cleanings a year. So if you're noticing bleeding gums, come in, get it treated before it gets worse so that we can make sure you don't get gum disease. A lot of my patients want to know if they can treat their own gum disease, if they can do some sort of rinses, or if they can start doing extra brushing or flossing. And the thing is that might help just a little bit, but once gum disease has gotten to a point where 30, 40, 50, 60% of the bone that holds the teeth in place is lost, treatment at home really isn't going to do the trick. Normal brushing and flossing is fine if you have mild gum disease, a little bit of gingivitis, if you come in and get cleans every 2 to 3 times a year. But once gum disease gets to the point where basically you've gone over the edge, you need real treatment, whether by me with a periolaser laser or with implants. It's not something that you can totally treat on your own. Those are for mild cases of gum disease where you can do extra brushing, flossing. You can use a water pick. You can use maybe a hydrogen peroxide or chlorhexidine gluconate rinse. And so when it gets serious, and for a lot of my patients, they've avoided the dentist for a long time, and it could be 5, 15 years, when they come see me, the gum disease is very bad. We have to do an intervention. And so don't worry, it's going to be all right, guys.